All right, let's dive right in. Today, we're talking about a technology that is poised to be a complete game changer for our health, and it all starts in our mouths. We're looking at the dental digital twin, a concept that could fundamentally change how we approach oral care. And it all kicks off with one pretty shocking number.
Okay, so 69%. Just look at that for a second. What do you think that represents in the world of oral health? Is it the number of people who actually floss every day? The number of us who are scared of the dentist? Well, the truth is actually a lot more serious. Yup. Nearly 70% of adults experience reoccurring gum bleeding. And that's not just some random annoyance, it's a major sign of active periodontal disease. We're not talking about a small niche problem here. This is a massive health issue that's been flying under the radar for way too long.
And here's the thing. For the most part, we just ignore it. We've kind of normalized it, but what we brush off as a minor issue has quietly snowballed into a hidden epidemic, and honestly, our current dental system just isn't equipped to handle it.
This really highlights the huge disconnect, right? On one hand, you have the patient's perspective. We've all been there. My gums are bleeding a little, it's no big deal. But then you look at the clinical reality, and whoa, it is a completely different story. It's seen as a massive, uncontrolled public health crisis.
So why is this such a big deal? I mean, it goes so much deeper than just having a nice smile. The health of your mouth is deeply, fundamentally connected to the health of your entire body. And when you start ignoring what's happening in your mouth, you're putting everything else at risk.
I can practically hear you thinking, okay, I get it, but seriously? It's just a tiny bit of pink on my toothbrush. How bad can it really be? And look, that's a fair question. It's a thought that has let this whole problem fester for decades. But the science, well, the science tells a very different, much more alarming story. That little bleeding is actually a gateway. It's a symptom of periodontitis, which is basically a state of chronic inflammation. And here's the kicker. That inflammation doesn't just stay in your gums. The research is crystal clear on this. It's linked to a higher risk of heart attacks. It can mess with blood sugar control for people with diabetes. It creates this low-grade chronic inflammation across your entire body. So no, it is not minor at all. And this right here, this visual shows you exactly why the current system is failing us. You see your dentist maybe twice a year. Let's call it 2 days. But the disease, it's working 365 days a year. That leaves this huge 179-day gap between visits where there's absolutely no clinical oversight. The problem is just getting worse, day by day, completely unchecked. So, to bridge that gap, we obviously need something new. The source material for this explainer puts it so well, almost like a movie trailer. It says, it's time for the digital twin to enter the stage. And this isn't just a small tweak, it's a total reinvention of how we do things. So what exactly is a dental digital twin? It's not just a fancy 3D picture or patient file. Think of it more like a living, breathing digital copy of your mouth in real time. It pulls together everything, your unique anatomy, your daily habits, even your genetics, to do something that sounds like science fiction, to predict and prevent disease before it even starts. And let's be super clear. This is not just another health app on your phone. A regular app is reactive. It tracks one thing, like how long you brushed yesterday. A digital twin is predictive. It weaves together everything, your scans, your brushing habits, your biological risks, to see what's coming. It doesn't just report on the past. It helps forecast the future. Now, this might sound incredibly complex, but it's actually built on 4 pretty understandable layers of data. 4 layers that are all about you, which come together to build your own personal twin. First up is the blueprint. This is a super precise 3D map of your mouth, usually from something like an intraoral scanner. Next, we layer on your behavior, which tracks what you're actually doing every day with a smart toothbrush. Then comes your biology. This includes things like your genetics or lifestyle choices like smoking. And finally, the 4th layer, the brain. This is the AI that crunches all that data and makes sense of it, helping predict what's next for your health. So what's the big payoff? What does this actually change for you and me? Well, it completely reimagines the entire point of dentistry. We shift from a system of waiting for things to break and then fixing them to a new world of proactive and deeply personalized care. I mean, just look at the difference here. The old way is all about reactive visits every 6 months, with your dentist giving you that generic advice we've all heard, brush more. With the digital twin, you get continuous monitoring and personalized coaching that's specific to you. Intervention happens before there's a problem. The entire goal changes. It's no longer about fixing damage, it's about preventing it from happening in the first place. And this isn't some far-off theory. There's a really clear roadmap for how it works. On day 1, you get your initial mapping and the twin is set up. Around day 30, you have a tele-review to see how things are going and adjust the coaching. By day 60, you're getting automated nudges based on your risk, and by day 90, you have a full-on quarterly audit to review your progress against your health goals. It's a real, tangible process. And the results? They're totally measurable. We're talking about a real reduction in gum bleeding, fewer of those deep periodontal pockets getting worse, people actually sticking to their home care routines because they see it's working. And that leads to fewer last-minute dental emergencies and, just a much better, more empowering experience for the patient overall.
When you boil it all down, it comes back to this one powerful idea from the source material. If over half of patients are bleeding, the problem isn't just the patient, it's the system. For so long, we've put the blame on individuals, when really, we should have been focused on fixing a system that was set up to fail.
So, I'll just leave you with this one question to chew on. What would it mean for you, for your health, if your dentist's primary goal wasn't to fix problems anymore, but to become your partner in making sure those problems never even happen? That's the future that the dental digital twin is promising. Thanks for tuning in.